Hey, this is Dr. Patrick Rhoades, and I'm here to talk about stem cells. But before I do, I'm going to show you this. It's a little certificate I got showing that I completed the certification training course for stem cells offered by the American Academy of Integrative Cell Therapy. It was a pretty cool meeting, and I actually learned quite a bit in the time that I was there. And I want to share some of it with you. All right, first of all, let's talk about stem cells. What are stem cells? They are pluripotential cells that can turn into all different kinds of cells. You know, they stem from where they were originally with you as a little bitty baby. And when you're an embryo, they can turn into a lot of different things. Now, these stem cells we're going to talk about aren't the same stem cells that were with you as an embryo, but they are what we call multipotential stem cells. Now, there's three kinds, or we get the stem cells from three different places. First of all, many people have heard of the bone marrow-derived stem cells. Now, these are stem cells that come from people's bone marrow, and usually they drill a little hole in the bone, and they suck a little bit of marrow out, and they get the stem cells from there. And then they separate them out and clean them up, and then inject them back into the individual. They're great in that they come from the same person. The bad part is it kind of hurts to do that. And second of all, they're usually old stem cells because people that need stem cells are usually old. And so their stem cells are old, and so they're not like newer stem cells. Another way people get them are adipose-derived stem cells. That way they suck a little bit of fat out of you, which seems great, but it's not liposuction. They're just sucking out some of the fat, and they pull some of the stem cells out of there. Now, it's again good because it is autogenic. It means it's coming from you. And so there's no kind of reaction to it, but again, old stem cells, not new stem cells. And it isn't alone if we don't get them. Finally, there's fetal stem cells. And people usually get them from the tissue that supports the fetus. They're not getting them from the fetus itself or from the newborn baby. Usually what happens when a baby is born, they'll get it from the placenta, the amniotic fluid, or the umbilical cord. The stuff from the amniotic fluid is usually what they call hematopoietic and is good for replacing blood cells. But the one that is used the most for pain and things like that is the stuff from the umbilical cord. In the umbilical cord, there's a substance called Wharton's jelly. And Wharton's jelly is tissue that contains stem cells, among other things. They usually cut that out, cut all the blood vessels out, and then they separate out the stem cells. Now, you would think, gosh, these stem cells are coming from another person, and there's a good chance that you could have an immune response to that, an allergic reaction. But the reality is, since they're from such new babies, they don't have any allergens hooked onto them, and so they don't cause any immune reaction. So they're really safe to give to people. Now, what's the beauty of these? Well, they're young stem cells. And young stem cells divide more rapidly, so they work better. Also, young stem cells have longer telomeres. Telomeres are little things on the end of chromosomes that tell a cell when to die. Think of it I think it's called the eyelet on the end of your shoestring. So that's what the telomere is on your DNA strands or your chromosomes. Anyway, because their telomeres are longer, they can reproduce longer. So they reproduce faster and they reproduce longer. So in that way, they're way more effective. Mesenchymal stem cells don't seem to form tumors. They mature into muscles, tendon, cartilage, bone, and adipose tissue. In fact, the stuff that's in mesenchymal stem cells from Wharton's jelly is a lot like cartilage. So it really is great in treating things like osteoarthritis, which is injuries of the cartilage and bone. And anyway, so it's really good for that. All right, so stem cells can stimulate other progenitor or precursor cells to reproduce and mature and promote the growth of new blood vessels, prevent apoptosis or cell suicide, reduce inflammation, and minimize scarring. Stem cells applied directly to the site of injury may improve healing rapidly. But stem cells do seem to seek out the injured parts of the body. I mean, that's one of the things they do, and it seems kind of magical, but it is reality. They go around your body looking for where the injury is and seem to go there. Stem cells work in 3 stages. The first stage is anti-inflammatory. They reduce the inflammation that's around the area. And inflammation, while it can promote healing at times, does cause pain, and it does cause a lot of things that aren't really good for certain areas to heal up. Secondly, the second stage after the inflammatory stage is the tissue rebuilding stage. So the stem cells help the tissue to rebuild and to heal. Finally, there's a genetic differentiation stage. So it actually changes the genes around the area. Anyway, stem cells are amazing, and they're really helpful in recuperation and healing, and can be used in many different ways. You can use them via IV. Really, mostly they use exosomes for that IV, but they're the little messengers inside of cells. But you can also use stem cells subcutaneously, or you could use them, inject them in the areas where there's pain. Stem cells are exciting, and hopefully you get excited about them as much as I do, because they can be really helpful for people and pain that does not heal from other ways. Thank you.